Good morning, everyone. Welcome to our weekly media briefing for COVID-19. I am Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services. We'll start with our numbers. We have had a total of 3,483 confirmed cases, including 110 from Sunday and 75 from Monday. We have done a total of 78,591 tests. We have 26 people hospitalized and 3 in the intensive care unit, and we have had 36 deaths. We have temporarily stopped reporting the number of people in isolation and quarantine, which also informs the active cases and released from isolation numbers, because they are people are put onto our isolation and quarantine lists after we have begun case investigation, and we are playing catch up right now with the very high number of cases that we have. So the numbers are not accurate, and we do not want to report numbers that are not accurate. So we will get those back up as soon as we have a better mechanism for reporting those numbers accurately. We are firmly in the purple tier right now, which is the highest tier that they have in the state of California. The threshold for that tier is 7 case rate per 100,000 people, and ours is much higher than that. Today with us, we have Robin Schurig. She is the director of Shasta County Public Health Branch of the Health and Human Services Agency. Dr. Karen Ramstrom is our health officer. Donnell Ewert is the director of the Shasta County Health and Human Services Agency. And Matt Pontus is the CEO of Shasta County. Do any of you have anything you would like to start us out with before we open to media questions?
Yeah, so this is Robin. I just want to reiterate some information that we shared with the board yesterday, and then I believe Dr. Ramstrom has some information she wants to share as well. I just wanted to bring people's attention to some information that is available on our shastaready.org website around 3 different topics. The first is our data. As Carrie mentioned, our numbers are quite high. And I just want to point out that we are obviously still in the purple tier, but we are well into the purple. So our unadjusted case rate that came out on Monday was 41.8 cases per day per 100,000 population. So that's about 6 times higher than what it would need to be in order to move us back from the purple to the red tier. That threshold is 7 cases per day per 1,000. And then if you look at the adjusted case rate, our case rate gets adjusted down because we have a high volume of testing in Shasta County. And so our adjusted case rate is 34 cases per day per 100,000 population. So again, still about 5 times higher than it needs to be to get us back to the red tier. The second thing is that we have posted some guidance about how to celebrate holidays more safely during the time of COVID. The safest way to do that is obviously only to celebrate with members of your household, or if you're gonna quote unquote get together with other people, to do so virtually. So via Skype or FaceTime or something like that, or over the phone. Otherwise, just stick with the members of your household. However, recognizing that some people are going to go ahead and, excuse me, get together with people from outside of their household, we have posted some guidance about how to make those gatherings more safe. So things like holding them outdoors if possible, keeping them small, keeping them short, and obviously abiding by distancing and masking. And then the third thing that I wanted to bring to people's attention is that the state has revised their mask mandate. So previously, the mask mandate from the state described specific situations in which you needed to wear your mask, and they've sort of reversed it. So now it says you need to wear your mask anytime that you leave your house, except for certain situations. So for example, if you're in a vehicle by yourself or only with other members of your household, then you don't need to have your mask on. Or if you're working in a room by yourself, like I am at the moment, then I don't need to wear my mask. But if I was in a room with other people, even if I'm 6 feet away from them, I still need to have my mask on now. So there's been some revision, some changes to that mask mandate from the state. And that is all I have.
All right, thank you, Robin. Dr. Ramstrom, did you have to add?
I do, thank you. Good morning, everybody. Yeah, I just wanted to provide a caution today. These numbers are very, very worrisome. and they're the highest that they've been, as Robin explained. And so this is a good time for all of us to stay close to home, taking those precautions that Robin mentioned, in particular the mask wearing when we're out, when we are not at our alone or just around our household members. We ask that you just take care of yourself and those around you, whether you're in your workplace and in your personal life. And for businesses, this is a really important time to make sure that you're using the modifications and implementing those with rigor in order to keep your employees safe and your patrons safe and our community members safe. For those of you who are diagnosed with COVID-19, please isolate at home. Don't wait for public health to call you. We will be in touch. But in the interim, please go to shastaready.org and click on the isolation quarantine link for more information. We have very high case numbers right now, and so we may be delayed in getting in touch with you. And we want you to be safe and at home in the meantime. So, now is the time. This virus is everywhere in our community. We really need to double down on these prevention measures. But, this is not forever. We will get over this hump as other communities have done previously. We had really good information and news this week with a second vaccine company that came out with very high efficacy numbers for their COVID-19 vaccination that they have been researching. And so that's good news. And so we look forward to hearing more from those companies as they release their full reports on their randomized control studies. So that's good news. In the meantime, we just all need to be careful and stay safe until we have these additional tools available to us to prevent spread in our community.
All right, thank you, Dr. Ramstrom. Anybody else have anything to add before we open to media questions? Hearing none, we are ready for media questions.
Yes, I have a question. I was hoping to get tested before seeing some family this weekend. And yesterday I made an appointment at Shasta College, but I couldn't make an appointment any sooner than next Wednesday. Is there any timeline on when we're going to get the additional testing station in Shasta County?
We don't have. Oh, I'm sorry, go ahead.
That was mentioned last week, I believe.
Yeah, we don't have a specific date. We were told by the state that the additional resources should be rolling out beginning this week, but we haven't heard a specific date for when our resources are going to arrive. So we are waiting to hear from the state. Hopefully it will be soon because there is a crunch for testing availability right now.
Could you elaborate on the resources? There was talk of, another testing station like Shasta College and also a mobile is all that still in play?
Yes, so the two additional resources that we are getting from the state are an additional fixed site, so similar to the Shasta College site, but it'll be at a different location, and we're still trying to nail down that location. So we'll let you know as soon as we know where that's going to be. And then the other one is a traveling team. So they will be able to have a regular schedule of different locations throughout the county where they go to provide testing. And then we'll also be able to deploy them if we need to send them to a particular location that's having an outbreak, or if like the schools wanted to do surveillance testing of their staff or things like that. So we'll be able to use that for a lot of different purposes.
I have a question for Dr. Ramstrom or Robin. With so many counties moving into the purple status, could that compromise the speed at which we see these new testing resources coming online?
I don't think so. I mean, they were already planning to deploy a lot of testing resources out to any counties that requested them. The state has just built a new lab that they're using for a lot of these testing resources. And so that lab is already online. That's where our specimens are going from our Shasta College site currently. So I don't anticipate a delay based on all of the counties, so many of the counties being in purple.
But just to confirm, it should be this week when those arrive.
That's the last we heard, but since this is Wednesday and we haven't been given a specific date yet, I'm not holding my breath, but hopefully soon. Hopefully we'll at least hear this week when it will be coming.
So I have a question. I'm following up on Steve's question about the wait for testing. Is there concern right now that you folks or the people that test, you're overwhelmed right now and you just can't accommodate people in a timely manner to get tested?
Yeah, there's definitely a shortage right now of testing availability. And so, yeah, it is taking people a while to get tested. And we're hoping that these additional resources will alleviate that.
I have a question for Dr. Ramstrom, I think, about the vaccines. What's the ETA on those? What will the availability be for the Shasta County?
Right, so it sounds like at least Pfizer, the first vaccine that we heard about a couple weeks ago, that they are going to be applying for their FDA approval in a matter of days, and then hopefully that it has to go through that process, and then expected to be available in mid to late December. There has been a lot of logistical planning around that between the at the state level with the federal government to the best of their ability to do that at this time. And we expect that initial push is going to be for high-risk healthcare workers and first responders. The state actually has a vaccine drafting guideline work group in place right now that's going to be providing additional guidance on prioritization and allocations across the state, and it will be based, that initial push is my understanding, on our number of high-risk healthcare workers and first responders. So that's our understanding right now. We don't know what those numbers look like, and as soon as we do, we'll share it with all of you.
And here's a random question. I've noticed driving around the Reading area that there are some restaurants that have tents set up for diners. I guess that's outdoors, but I mean, does that really count? Is a tent different than being inside, or is it kind of the same when there's all four walls of a tent there?
Yeah, so the guidance from the state says that outdoor dining, if it's going to have any walls around it, whether that's being up next to the building or being a tent, it should only have one wall and three sides should be open. And so there has been some misunderstanding of that among some of the restaurants, and there have been some 3 or 4 walled tents being set up, which does not count as outdoors. So we are working on educating restaurants about those requirements.
Thank you.
Good morning, everyone. It's Anna here. I just want to piggyback to the vaccine. Dr. Ramstrom, I think you mentioned it yesterday at the Board of Supervisors meeting. So right now, what hospital here in our county looks like could be getting this vaccine first?
So there's a variety of different strategies and groups that the state is pushing vaccine out to. They've talked about pre-positioning at some hospitals. I don't know the status of that. They've selected 7 hospitals statewide, and Mercy Medical Center was one of those hospitals. That's for an initial pre-allocation. So that would be one of the earliest facilities to receive for regional use. And then in addition to that, the state is working with facilities that cross county lines. And so, for example, Dignity or Common Spirit, as you know, has multiple facilities statewide. And so they would be coordinating at the state level to figure out with those entities how they want to distribute within their systems. And so that's something that the state is managing. So we don't have to do that here at the local level. And so all of these, the hospitals are going to be the focus of this initial push. And so their focus is on high-risk healthcare workers. So they're going to be defining that. And we anticipate that will be people who are caring for people with COVID-19 or are likely to come in contact with those individuals. And so we'll hear more soon based on that state drafting guideline work group. I can't answer that specifically, but all hospitals at some point will have access to those vaccine supplies.
So just to be clear, it's still unknown the rest of the hospitals in our area will be getting it, but it sounds like MNCR is one of the first to get the set because they're predisposition, correct?
So all of our other hospitals, except for one, are part of these groups that actually have multiple. Their corporate offices will be contacted by the state to determine how they want those supplies, those vaccines distributed to them. And so that the only hospital that is not in that group would be Marist Memorial, and so we'd be working closely with them. And so, yeah, I think all of our hospitals are covered. It's just a matter of which stream it's going to be coming. It's quite involved, and the logistics are in the works right now.
Doctor, could you talk a little bit about the logistics of the vaccine, how to get it here, how to store it? I know yesterday when you were speaking, it sounded like Mercy Reading was going to have the vaccines, but they were going to be stored in Red Bluff or in Tehama County. Could you kind of talk about, what you have to do to get the vaccines here safely?
Yeah, and sorry, I know this is really confusing and it's all evolving every single day. And so, this is what we know right now. Mercy Medical Center Reading is one of these pre-positioning hospitals, 7 of them statewide, so they will get a supply. In addition, these multi-county entities like Shasta Regional Medical Center and also Mercy, they will get their supply that will be coordinated across their corporate office, however they want to distribute that. And then in addition to that, there's a system for healthcare providers to sign up and enroll to register to order vaccine. And so we will be helping our other providers to do that. Right now, the only other provider that's relevant to would be really Marist Memorial Hospital, since they aren't going to receive it through those other 2 streams from the state. So, and again, we have until mid to late December, before those supplies are going to be available, and it has to be approved first. And so we have all those steps to get through before we can get, before we'll be in that position.
What about actually, though, the vaccines themselves and having to keep them at sub-zero temperatures? And do we have enough freezers, and how's that supposed to work, or do we know yet?
Right. So that's the other pieces that are being determined. Those 7 hospitals statewide were chosen because they have those types of freezers. And the state is also positioning regionally some of those freezers that can go down to that really low temperature, which will be available for the region for other counties to access through those locations. Our other hospitals have some of that freezer capacity, but all of that's in development right now.
Thank you.
I have a question, a real quick follow-up on the vaccine. So if I'm hearing you right, Dr. Ramstrom, Mercy should be getting their first batch of vaccines because they're one of these 7 hospitals before the end of the year, maybe mid to late December?
Right. We've heard for Pfizer, the push out to all of these entities won't be sooner than mid to late December.
And do we know how many of the vaccines Mercy will get in that first allotment?
No, we don't. We don't know yet.
Doctor, how are you going to promote people getting vaccinated? We have a pretty large contingent of people who are against vaccinations. What do we do to try to get them to get vaccinated so this will be effective?
Yeah, it's something that we're talking about. I think there's a few things that are very reassuring. One is that the state has established a scientific safety review work group. And that work group is working in California in partnership with Washington, Oregon, and Nevada. And so vaccination experts and physicians from those states will be working on this together through this work group to review all the data that comes out from any approved COVID-19 vaccine before it's pushed out to Californians. And so that's an extra step of safety review to make sure that we feel that it's safe enough and effective enough to distribute to our population. So that's very reassuring in my mind. The other thing too is that It's been quite an innovative and successful effort to date to get these vaccines developed with such rigor and safety precautions in place and expectations for demonstrating efficacy in such a short period of time. And that's been accomplished in part because manufacturing was happening simultaneously as the vaccines are being developed. And so it's a huge investment and risk by those companies to manufacture while they don't even know if their vaccine is going to be approved yet. And so that just helps us to get it, to receive it for our use sooner instead of having, the randomized control trials to happen and then the approval and then the manufacturing. And so all of that's really very reassuring in terms of the processes that have been in place to make sure that we're not sacrificing any of the rigor that is normally implemented to develop these vaccines in a manner that is going to demonstrate their efficacy and safety before they're pushed out to the public.
I'd like to just follow up on that a little bit as well and just say that I don't think a large percentage of the population is anti-vaccine. I think it's a small percentage. There is a large percentage that's vaccine hesitant, and that is the group that really needs that safety information, and they may take a little bit of a wait and see point of view, and that having the extra review in California, I think, as Dr. Ramstrom mentioned, is going to be very helpful. But I do believe that folks are going to come around. And we are also, very fortunate to have a high efficacy rate of the vaccine itself. So a high percentage of the people vaccinated will be immune, which will help us decrease transmission. But of course, we do want a large uptake. The more people that get vaccinated, the sooner our community can get back to normal. So we're hoping that folks will review the safety information and choose to get vaccinated.
Yeah, and Mike, an important piece of that is you all, right? And so as we learn information, we're going to want to make sure that we get it out and share what we know as we're learning about the results of these trials and the findings of the California Scientific Safety Review Work Group. And so that's going to be a really important piece, I think, is partnering with all of you to help get good information out to the public.
Well, Doctor, you kind of answered the question I was just going to ask. Will there be like a local effort? Is it going to be on the national level? As far as I'm sure, there's going to be some kind of a get vaccinated campaign done.
Yeah, we're definitely talking about it here. I think the state, I'm sure, will be preparing to get information out to the public. I'm not sure what's happening at the national level. And all of that is in a little bit of it's a little bit stuck right now at the federal level. And so we're hoping things are going to move along quickly soon.
Thank you.
I just wanted to follow up on something regarding the vaccine. So what is the timeline of the vaccine distribution? It sounds like, it could be here sometime mid to late December, and it starts with the healthcare workers or at risk and first responders. So what about the rest of the community and the population?
Right, so there's some guidance that's been put out by the National Institutes of Health. That's a 3-phased approach, and that lists the different entities in each of those phases. And phase 1 is when we have limited supply, which is the phase that we're planning for right now. And then as more supply is available going into next year, then phase 2 would include people who are moderately at risk because of medical conditions, a variety of different kinds of essential workers, that kind of a thing. And then there's others that are in that group in phase 2, and then phase 3 would basically be everybody else. So that table and information is available. So those 3 phases sort of outline the groups over time. But right now is the tricky part, is when we have limited supply. And so how do we prioritize when the vaccine is initially available?
Thank you for that, Dr. Ransom. I do have another question, just a few more. Are there any concerns from public health standpoints about this rapid development? Because normally it takes a while for a vaccine to, go through its phases, but in this case, it's not a very unusual, it's a very unusual time we're living in, so it's going through a rapid development.
Right. So again, you know, we're really, I've been really impressed actually about this. It's actually been an international effort to figure out how to safely develop vaccine in a manner that's really going to be able to demonstrate whether it works and the how effective it is and how safe it is in a short period of time. And they've done that largely by doing the phases of a normal vaccine trial in parallel instead of sequentially. And so they've done that, though, maintaining all of the regular safety steps. And in addition, I think the big game changer is that they've been manufacturing vaccine before the trials are finished and before the study findings are out and before they've been approved. And so once it goes through and they actually meet the benchmarks for showing that it's effective and safe, and they submit to the FDA, the vaccine is already manufactured and ready for distribution as soon as that those hurdles are met. And so all of those pieces, I think, are really reassuring. In addition, we have this California Scientific Safety Review Work Group that's going to look at the data that's published by the vaccine manufacturers so that we have our own independent review by state experts. So I think all of those pieces are very reassuring, and the requirements that the FDA has put in place in terms of safety and performance are steps that the companies have to meet even before they can submit for approval. So all of that's really very reassuring about the rigor of these studies.
I would just add that we owe a debt of gratitude to all the participants in the trials who stepped forward to make this happen. So we shouldn't forget them.
Thank you for that, Dr. Ramstrom. Just a couple more. So is the county optimistic about this potential vaccine coming our way? And would you consider this the solution to the pandemic that we're facing?
Yeah, I'm very optimistic. The initial efficacy results that have come out from both Pfizer and Moderna are extremely impressive. The FDA's requirement is 50% efficacy. Both of these studies set as their minimum standard for their trials 60%, and their actual findings are over 90%. We'll see what the final results look like, but if they're finding that early on, that's really, really reassuring. And so, yeah, I think that as Donnell mentioned, the more effective a vaccine is, the more likely we're able to use that and get community immunity or herd immunity so that we can reduce transmission in our community and then be able to do our containment strategies, which we can't do. We cannot contain this virus right now. Doing our regular case investigation and contact tracing is just too many cases. But once we have enough people vaccinated, we'd be able to do that so that we can reduce transmission. And so that's absolutely what we're looking forward to, hopefully making really good progress on that even by, mid next year.
Thank you for that. And just to be clear, so before it can even come here to Shasta County to Mercy Medical, it has to, I want to just clarify, it has to be approved first, correct, by the FDA before it can get distributed?
Yeah, I'm not sure how they're managing all of that, to be honest with you. That's sort of before it reaches us. And so it certainly cannot be administered before it receives FDA approval and it goes through the scientific safety review at the state level.
I have a question. This is not vaccine related. Is there any talk of getting the field hospital up and ready to go? And I believe that would be at Shasta College. Correct me if I'm wrong.
So we've been planning for that for months now, and we actually had a hospital surge meeting this morning, and so that's always part of our conversation. And the goal is always to try and prevent as many infections as we can so that our hospitals are actually able to manage these patients in a normal manner where they can be cared for with in the facility, in the hospital facility. And so we're prepared if we need to move in that direction. Based on conversations, even as of this morning, we don't need to use that site, but if things change, we're certainly monitoring our hospitalizations very closely and continuing close conversations with our hospitals and have a plan to be able to implement that. You're correct, out at Shasta College, should the need arise.
Any other questions? Okay, hearing none. Thank you, everyone. We will be back next week, Wednesday at 11 a.m. Thank you for joining us. Everyone stay safe and healthy.